Welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are talking all about speech and language pathology. Today on my show, for my guest, I have Adrienne Wagster. She is a speech language pathologist with the Lift Therapy. Welcome to the show, Adrienne.
Hello.
Hello. So I actually know you. People may know us from the local theater scene here in West Tennessee with the Jackson Theater Guild. So welcome to the show. And I know you've recently started with West Tennessee Healthcare not too long ago. So yeah, tell us kind of what your job is and how you got involved with West Tennessee Healthcare and speech.
Yes. So I started working for West Tennessee Healthcare at the Lift in July of 2024. Okay, so last year.
So almost a year.
Yeah. So almost a year. We're getting there. I have really enjoyed it so far. It is such a great job. And I'm just working with the most amazing therapists. It's just a really good workplace. It's a good place to be. I see a full range of clients, which is really, really fun. It keeps my job interesting. So yeah.
Yeah, that's what, and I've interviewed different people. It's like a lot of our jobs here at West Tennessee Healthcare, it's never the same day twice, which I like. I like a lot of variety in that.
Yes, that's exactly what it's like. Yeah, you never know what to expect. You always see a new case and you learn a new story. And it's really inspiring. And
there's highs and lows. Yeah, I was gonna say, there's a wide range there.
Absolutely. Yeah, that's just part of the job.
Right.
Yeah.
So May is Better Hearing and Speech Month. Yeah. I guess that's kind of how people say it.
Yeah, that's right.
And I know for me and for the general audience, I would assume we don't know a whole lot about speech language pathology, speech therapists, speech pathologists. You hear about it. I know I have people in my life that have people that go do speech therapy, but as I think maybe a general person wouldn't specifically know what that entails. Yeah. So kind of what schooling did you do? How did you get involved in that? And what does a speech pathologist do?
Yeah. So basically
that was a loaded question.
Yes, no, you're good. So I started by getting my undergraduate degree in music, which was it's not typical for somebody becoming a speech language pathologist. So I started at Union University and I got my 4-year undergraduate degree in music with a focus in voice. And once I finished that, about halfway through that, I was like, I want to be a speech therapist. And I decided that. My mom is a speech language pathologist. And so that was a big inspiration for me growing up. Cindy Wagster, she worked at the hospital for 30 or 35 years before she retired. And so I learned a lot from her. So I got my undergraduate in vocal music at Union, and then I went and got my post-baccalaureate and master's in speech language pathology at Murray State University. Good. And it was such a great experience. Both of those schools are wonderful places to go. And no regrets. It was super fun. So I went there. And I learned all about speech pathology and I did my clinicals and all of that. Yeah. And then I started my journey as a speech pathologist.
So is this your first job in this role?
No. Okay. So my first job was in 2019. Okay. I was a pediatric outpatient speech language pathologist. And that was in my clinical fellowship year. That's where basically you have somebody supervising to make sure you're doing everything right. But that was my first year. And I was in West Palm Beach, Florida.
Oh, wow.
Yeah, it was really nice. And so I lived there for a year and then COVID hit and I discovered the world of teletherapy. Yeah. And so I worked in teletherapy for 4 years after that. And so this is my 5th year as working as a speech language pathologist. And this is definitely my first role in working in an outpatient adult clinic. So I had a short while where I had my own practice and that was called All Voices. And I had that for about a year, 2 years. And I did teletherapy online with adults. So that was kind of my introduction to adults. Great. But so since July, I've been working in the adult outpatient scene and getting to work with a ton of different patients. And it's been really, really fun.
Great. Now, and I wondered how you went from voice to speech language, but your mom, so that worked out.
Yeah, it makes sense.
But then also you already learned kind of.
Yes, there's so much that intertwines with vocal music and learning about speech therapy. Because I'm also a voice therapist. That's part of speech language pathology. And so I learned how to teach voice when I was at Union. Right. And then I learned how to provide voice therapy when I was at Murray State.
Right, yeah, because singing, talking, I mean,
yes,
it's all, you're using the same.
Correct. Yes. And I help with singing as well.
Right.
But yeah, so it's the voice. It becomes impaired, and I'm here to help with that. So yeah, it's pretty cool.
Now, I know you mentioned kind of at the beginning, when you kind of first started, was the pediatric side.
Yes.
Talk to me about the difference between, because I mean, a lot of the people I know, they would send their children to get. So
yeah, that's how
what's
it's
the difference?
known.
Yeah, I was going to say, what's the difference between the pediatric side and the adult side? Yeah.
So pediatric speech therapy is similar in the way that it's something that you do to intervene for someone that is having problems with their speech and language or cognition or swallowing. And so for children, a lot of times they'll come see a speech therapist if they have certain diagnoses, like they may have autism spectrum disorder or Down syndrome or, cerebral palsy, and they may have some difficulties with their articulation. And so there's all kinds of stuff, all kinds of reasons for a child to see a speech therapist. But in the pediatric setting, when I was working with children, I worked a lot with AAC, which means alternative and augmentative communication.
Okay.
And that's using pictures or a device to help a child speak when they are unable for whatever reason. And so I began in working in that setting, working with kids that were non-speaking and giving them other opportunities to talk and communicate with others.
Right.
And so I did a lot of that. There's also pediatric swallowing. It's a big field. So that's the pediatric side. And I worked in schools for 4 years remotely. And when I did that, I was working with a lot of articulation and a lot of language disorders, primarily. And so, yeah, it was a really good experience. So working in the adult population is quite different because we're focusing on things that have happened later.
Yeah, like it. Well, and even with the pediatric side, I wouldn't even think about like devices to help communicate.
Yeah.
Like if it's a nonverbal or less verbal situation, because communication's not just talking. It's
there's all kinds of ways to communicate.
and you're giving those children
the
tools and the devices, to make that happen.
There are so many ways to communicate. There's sign, there's verbal language, there's gestures, there's behaviors that crying, like there's all kinds of ways that you communicate to somebody how you're feeling and what you need. And another way is to use a device and choosing buttons that will speak for you, so that that takes the load off of you and you're able to communicate.
It's communicating and connecting, because I mean that's the most
important
thing.
That's what we all need.
Humans, that's what humans do.
Exactly.
So so you mentioned right now what you're doing is working with adults.
Yes.
So what are the things that could bring someone to see you as an adult? What are the ways that they would need a speech language pathologist?
Yeah, so that would be, somebody that has had a stroke or that has had a traumatic brain injury. I see people with all kinds of diagnoses later in life. Could be from Parkinson's to ALS. I just all kinds of diagnoses come to my door. I also see a lot of voice patients. Anybody that may have a disorder in their voice that they are diagnosed from an ENT, they would come to see me for voice therapy. And so I've got a very wide range. I see people that have swallowing disorders, often following a stroke, things like that.
Okay, yeah.
And then I see them for their speech and language. So I'll kind of lay that out a little bit. When you have a stroke, for instance, and this is with other diagnoses as well, you could develop something called aphasia. And aphasia is where somebody has difficulty getting their words out and saying things the way that they mean to say them.
Oh, yeah.
And they can also have difficulty understanding the words that they're hearing.
Yeah, so with their own hearing.
Yes, exactly. And so it goes both ways, and it just is different for every single person. But that can be a common thing that I treat. I also treat apraxia, which that can be in childhood apraxia or an adult where they had a stroke or something like that and are unable to say the words in the correct way. And so that's like being able to say a word and the sound is coming out different. Like instead of we talk health, it would be we call tell something kind of like that. It wouldn't come out how they mean for it to. Mm. And then I also work on dysarthria. Those are kind of the 3 pillars of what kind of speech and language disorder you may have following a stroke. And so with dysarthria, that is where you have slurred speech, your voice may change, the words come out heavier and slower, and it's more difficult to communicate in that way. And so,
and I mean, having difficulty communicating it's got to be, very, very difficult. And so, having those resources here in West Tennessee for the West Tennessee healthcare community is great. Yeah. So you mentioned ENTs. So how would someone come to you? Mm-hmm. What would they need to do to, if they think maybe they do, or if they have an ear, nose, throat doctor that has diagnosed them, how would they be sent to you?
Yes. So for any of the things that you may need a speech therapist for, whether it be swallowing, voice, speech, language, or cognition, you will talk to your doctor first. And so for most of the things that you see me for, a doctor will need to refer you. Okay. And so it's important to talk to your doctor, or if you're at the hospital, for instance, they will usually write you a referral if you need it upon leaving the hospital to come and have outpatient therapy following your inpatient and all of that. Right. So a doctor referral is usually needed, especially for your insurance to cover it. Yeah. We take pretty much all of the insurances in our area. Okay. Definitely talk to your doctor first and see if you are eligible for that. And if so, they will send a referral to us and we'll get it going.
So what is like the average time? Is there a time span that they would spend with you?
Mm-hmm. It depends. Yeah. So let's say if I was just working on someone that has dysarthria, their speech is slow, I may give them some tools to help them. It may not take very long. It may be just a couple weeks that I see them, maybe twice a week for a couple weeks. And then for another person, they may have really severe aphasia following a stroke where they can only say a few words at a time verbally. And so I might work with that person for 3 to 6 months, twice a week. And so it really varies quite a bit depending on the diagnosis and the need of the patient. Yeah.
And so you work out at the lift therapy. Are there other areas in West Tennessee that do them? I know we talked a little bit earlier about, I think Dyersburg has the pediatric side.
That's right.
But they do
they have one adult speech therapist there as well. Okay. So if you're in Dyersburg, it is possible for you to get some speech therapy
for you to potentially stay there.
But we don't have many right now. Currently at the lift, it's just me. Yeah. So I'm the only adult outpatient speech therapist there. There's of course speech therapists at the hospital, and there's speech therapists that are at our rehab clinics, and kind of throughout in different settings like that. Yeah. But as far as adult outpatient, it's mostly just me and Jackson. Yeah. I think there may be others, but I would love to reach out to them. I know there is one at the Star Center. So it is definitely a need. We definitely could use some more.
And I mean, it is funny because it's like physical therapy.
Yes.
For the voice and for the mechanisms with talking and swallowing and things like that.
Yeah. It's all about our brain and our voice and how they connect. It's all interconnected. Right. And so, it's important to come and seek therapy for your speech, just as important as it is to seek therapy for your occupational needs or for your physical ailment.
Right. Mm-hmm. One final thing before we wrap up. Do you have any stories of something that's inspired you or kind of kept you going with people that you've met and people that you worked with and how it's helped them or kept in touch with anyone?
That's a great question. So I took the place of Jeff Johnson, who he has retired, but he was the speech therapist that was there before me. And I was so inspired by his work that he provided at the lift before I started. I got to work with him for a month before he retired. And so he got to show me all of his tricks of the trade before I started, and I've also known him a long time. He's good friends with my mom because they both are speech therapists and have worked together. And so, it was so inspiring and helpful to learn from Jeff when I started here at West Tennessee Healthcare. And so he was a big inspiration for me. And honestly, in this time that I've worked for West Tennessee Healthcare, I would say every single patient that I have that comes across my desk is so interesting and so different and has a new story to tell. Not one person is the same as the other.
Right.
And so it's just every day I am shocked and inspired and grateful.
Right.
And it's just a wonderful experience to meet all these new people all the time that are there for my help. And I've been very inspired just by the people of Jackson in general that are here to see me. So it's been really nice. Yeah.
And I'm glad we got to talk. And, with, the Observance Month of Better Speech and Hearing, it's so good to just kind of put that information out there, educate the population about how important communication is and communication disorders, helping people communicate better and be more connected.
Yeah.
So I'm glad that this is something that we have, and I'm glad I got to talk to you and bring you in here and get to learn all about the behind the scenes of speech language pathology. Because I've heard about it, but I'm like, I don't know what they do.
Hopefully this will bring some education and understanding.
Right. Yeah. So anybody, I guess if you don't have an ENT doctor, you just have a general a primary care doctor. If you are struggling with anything like that, ask them, and they can refer you to someone. And
yes, absolutely.
Hopefully come see Adrienne.
Yeah, just any of your doctors. I often receive referrals from neurologists, from ENTs, from, yes, honestly, lots of...
It can come from, so
your family doctor.
It doesn't even just have to,
correct. Yes, it can come from... all kinds of doctors that send their referrals to us. So talk to your doctor, see if you would need something like that, and come see us.
And this maybe isn't as well known, so getting that information out there to the public so that they can advocate for themselves and say, this might be something I need, if you're having any of these issues.
Yeah, you're exactly right.
Well, thanks for coming on, Adrienne.
Yeah,
this was so fun to reconnect. We've done theater together, so you might see her in an upcoming in some sort of upcoming local show.
Yep, I'm in Hunchback of Notre Dame coming up at the Ned. So if anybody wants to come see it,
all right,
that's
local theater.
Yep.
All right. Well, thanks so much for coming on, and glad to hear all about what you do.
Yeah, thank you so much for having me.
Thank you. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.